over how we take care of our health.
Amen. Thank you. And I just think what Robert said is really important, right? Because people don't have a chance to come up. People when they're behind the wall. And there's Dan Hurley. Give it up for Dan Hurley. Comes from a great family. He works for the Senate President Nick Scutari. We're really honored that he's here today. And but when you're in prison, like people don't know, prisons aren't like hotels. Because when you're in prison and when you try to go to a hospital, you lose all of your privileges and sometimes your room. So Almar, why don't you give us a few words? And Almar dressed up real special today.
Thank you. First, I would like to start off by saying good morning and thank you for everyone for coming. I would like to start off by saying if you want to know what it is the reentry can do for you, you're looking at a prime example of it. I started out in those very same seats as you, and I know what it's like to need healthcare. Healthcare is one of the primary things, especially coming home from incarceration where you're not living in the best circumstances. You don't have access to the best doctors. You don't have access to even having the privilege to treat yourself accordingly. So with that being said, coming home, some individuals deal with the PTSD. So having healthcare and being able to get treated mentally so you're able to properly adjust into society. People don't understand how important and how crucial that is. When we're coming home and we're trying to figure out the step-by-step. When you catch a cold because you're not used to being outside every day, because you're used to being confined in a room. You don't know which over-the-counter medications to take, so you want to go to a doctor. So I think, everyone should know the importance of having access to it. And being here at the reentry program, they go above and beyond. They're going to go in that office. They're going to make a call to someone. They're going to shift around. They're going to spend hours. They're going to tell you come back the following day. Sometimes they're even drawing out paperwork. I promise you that if you give it a shot and you're willing to try it a different way, they'll provide you a different avenue. Thank you.
You're only a half hour late. Typical doctor.
Oh, and I would like to give Jim here a great thank you for being supportive.
Thank you. So, like a typical doctor shows up a half hour late, like whatever. Yeah, you're good. You're good, Doc. Come on, get out. And so now I just want to introduce, and then we're going to hear from our mayor, Anthony Nunez, the Director of Community Health Workers. Anthony.
Hi, everybody. So, listen, we're happy to be here. We have this partnership with New Jersey Reentry because we know that it's important to meet the people where they're at, get them connected to healthcare, remove barriers that we know, impede people's access, whether that's transportation, housing, utilities, whatever it might be. And we have our community health worker embedded here. And now in partnership with Dr. Egan in this wonderful van, we're happy to be able to offer these direct services and try to get people connected to care. Health is wealth, guys. Health is wealth, and we're happy to be a part of your journey as you guys get back into society and reentry. We value you guys as members of society, and we think that you guys deserve a chance. So obviously, through our partnership with Jim, it's been a great opportunity for us to be able to do that and serve you as you need. So our team is here for you at any time. I'm sure some of you guys have seen Jonathan here with Carlisha. We're available for you to serve you. Thank you.
Thank you. And then we'll stay up here. And then Doc, come on up here. And now, before we hear from Doc, we're here because in every community there's a leader. Stace, come on up here. Stace is a volunteer nurse. And I'm just going to ask Lourdes and Stan if they can join us while the mayor comes up here. Where's Lourdes? But like in every family, in every community you have a leader, right? So one of the people who've been our great champions, in addition to Carlisha, in addition to the entire team here, is not only the commissioners, and I want to thank Lourdes and I want to thank Stan, but also Mayor Bullich understands the importance of meeting people where they are in the community, right? So you see a lot of different places around the country get developed. What I love about Mayor Bullich is he's the real deal. He grew up in this community. He bleeds for this community, bleeds for the city. And he said, Jim, I want to make sure these guys have the right health care. So this didn't happen by accident. This happened because you have a great mayor, much better than this might. Give it up for Mayor Chris Bullich. Thank you very much, Governor. You know, it's a great pleasure to work with former Governor Jim McGreevy. He did a great job as the mayor of Woodbridge and then as the governor of our state. And, you know, he could have just sailed.
Up the north, sit in air conditioning. No, he goes out and gets a grant to create a street medicine program here in Elizabeth and throughout the surrounding regions. So that's terrific. Here's a guy who took the time to be creative and to find a solution to a problem where people who have no access to health care probably don't even know where the emergency room is at times. And then he's going to go out to them and service some of their health needs. And that's an absolutely terrific effort on behalf of our city. I've been with Dr. Egan. I've toured this bus. At some point, the president of the hospital and I are going to go out in the evening or in the late afternoon and actually watch them work on a day-to-day basis. So Governor, you brought him here. You're doing a great job with a population that may not have a lot of different services. But I really want to thank you for matching up reentry with healthcare. I think it's a great blessing for our community. Thank you, Governor. Thank you, Dr. Egan.
And we got to give Anthony praise. Not a raise, but praise, All right, Doc, go for it.
Thank you all for being here. I thank you all for being here. I'm sorry I was a little bit late. I made a wrong turn. This van, this team, these people up here, we are at your service. We are out on the streets to take care of people out on the street, where they are, when they are, to take care of what we need to take care of. This is not a polished program. This is a program that is flexible to the needs of the people, flexible to the needs of you, who may not have access to doctors, who may not have access to appointments, who may not have access to community health workers. This is a program that connects people. It connects people on the street. It connects people with resources, with knowing that we go out there. I go out there with my team and a bunch of other teams because we love you, because someone cares about you. We care about you enough to go find you where you are to take care of whatever we need to take care of. It's powerful for you, and it's powerful for me as a physician to be able to do what I signed up to do. We may have broken healthcare systems, but this is a way to try to at least put a Band-Aid somehow, some way. We're trying to fix problems that are way above our head, way above the city level, way above the state level, way above even the federal level. Like, there's global issues that don't have to be global. They're Elizabeth. We do this program in Elizabeth for Elizabeth and for the people of Elizabeth. So thank you for being here. I'm happy to take care of whatever you guys need. All right, thank you.
Yeah, and then we're going to call upon Lourdes first, and then Stan the Man, and then Carlicia, who directs them. All right, Lourdes, you want to go first? Come on.
Good morning, everyone. I'm Commissioner Lourdes Leon, and I'm extremely glad to be here today. I see that the reentry program has joined Robert Wood Johnson for this street medicine van, and this just gives people opportunities that cannot reach the hospital. So this street medicine team is just amazing. I was able to join them when they first got the van, and I went inside and I loved every minute of it. This is just so much opportunity for those that cannot get health care. And Dr. Egan is amazing, and I'm extremely happy to be here joining you, and thank you.
Prepare for a connection to all the right training for the right city.
Okay, we're going to do that. Good morning, everybody. How's everybody doing?
It's a pleasure to be here with you today. Again, my name is Stanley Neron, Union County Commissioner, and I'm also Director of Recreation for the city. And I just want to thank our governor, along with Street Medicine Dr. Egan and his entire team, New Jersey Reentry Corporation, for continually spreading love. And that's what this great man here does. He spreads love throughout all the communities that he comes in contact with. And spreading love is something that you lead intentionally, right? You have to be intentional about spreading love and making sure that you first love yourself. And in loving yourself, we got to take care of ourselves. And when we talk about street medicine, we talk about healthcare, we're talking to everyone here, right? Even ourselves as we're talking about this. Because oftentimes we don't get ourselves checked, right? We don't take inventory of ourselves to find out what gets us a tick, what keeps us going, what gives us a good bill of health, and it's so important that you take care of yourself. And I know you've heard it already, your health is your wealth. And when it's not about money, it's not about a job, it's about really taking care of yourself. If we can just eat right and do right, we would minimize the issues that we have with diabetes, heart conditions, and so many things. So I implore everybody to, spread the wealth, spread the love, and keep spreading love with each other, and understand that iron sharpens iron. We make each other better. And as the doctor said, we love you. We're going to keep growing with you. Thank you for all the great work that you're doing. As a Union County Commissioner and the entire Commissioner Board, we're proud to stand with you and continue making sure that efforts like this continue to exist in our community. God bless you all. Oh, you want me to talk about boxing? I'm sorry. You want me to talk about boxing? So on August 22nd, for our 4th year, we do boxing at the waterfront here in Elizabeth. So we've been doing a lot of innovative programming here in our city, and we bring boxing to the streets, we bring boxing right at the waterfront. We have about 20 bouts lined up. We have kids from ages 8 all the way to 30 fighting. And hopefully you can come out. A lot of former champions come out. Again, it's August 22nd, Elizabeth Waterfront. And the fight starts at 3 p.m. Weigh-in starts at 12. So hopefully you can join us. But, if you're a boxing fan, come out and enjoy. God bless.
Thanks, Commissioner. Can we have a round of applause for our commissioners? All right, now I want our guys to all come up here. Come on up. Get up. Everybody. Come on. Come up here in the picture. We're going to have Carlicia say, get out of those seats. Yeah. Come on. You're both family. I love what Stan said, but love the Lord, and Dr. Egan say, come on, everybody together. Yeah. Are you a human being? Come on up. How about that? Okay. All right. Carlicia, you got to say a few words and then we'll take the photograph.
Good morning. I'm going to be brief, but I just want to say thank you for coming out today. Really appreciate it. Really appreciate the partnership with Dr. Egan and Anthony and the whole RWJB. They come here on a weekly basis to provide services to our students. So we are always grateful for the partnership. And medical services is definitely important and critical need for individuals that's coming from behind the wall. So just take advantage of that.
Thank you. All right, Carlicia. And Carlicia, how many years you been at this site?
For about 5 years.
Give it up for Carlicia, doing God's work in Elizabeth. Now, here he is. Here he is. Come up here. All right, can we take a picture?
This is a van that is created by the street. So this is really just to transport our staff, our supplies. This is not a mobile health van. So it doesn't have a sink, it doesn't have a bathroom or anything. It just got our supplies so we can take care of what we need to take care of.